Dave the pharmacist here again. So time for another incredible drawing from Dave. This is a drawing of your liver. So essentially your liver is a organ that just sort of filters blood. So blood comes into the liver and it runs by all these cells that sort of take out toxins and metabolize things, and so it's like a big filter, and then the blood comes out the other side and goes out about its business, but cleaner than it was when it went in. The statin drugs that you use work primarily on these cells in the liver, and so the way it works is, if you remember back in the day, I don't know, a few minutes ago, I told you that cells in the body have their own machinery that can make cholesterol. A statin drug is a drug that goes to the machinery, and mostly for statins, it's inside liver cells. So they'll go to this machinery and they'll block or inhibit one of the steps that is necessary for a cell to make its own cholesterol. So of course, what does a cell do if it cannot make its own cholesterol? Here's a test. Do you remember? I don't know if you remembered or not because I can't hear you. But essentially what happens is a cell that can't make its own cholesterol will build an LDL receptor. An LDL receptor. Right? And that LDL receptor will collect LDL from the blood to get the cholesterol it needs. So if the unique thing about the liver is the organ that really filters all the blood. A ton of blood goes through this liver every minute. And so there's a huge blood supply going through. And so if you look at a liver before you take a statin, there probably are a few LDL receptors sticking out, but not that many. If you take a statin drug, the statins go to these liver cells, and essentially what they do is they inhibit each of these cells, probably not all of them, but they inhibit the machinery to make cholesterol. And so what do you get after all of these cells can't make their own cholesterol anymore? Well, so what I've done is I've just drawn LDL receptors that are now produced in way higher quantities in these liver cells. So imagine now this LDL that's coming in as part of the blood and floating through here, much of this LDL is going to be picked up by these liver cells now, because all of them, and of course not all of them, but many more of them have LDL receptors sticking out of their cell walls. So the LDL that's coming in here is going to be picked up by these cells, and so when it comes out the other side, there's going to be way fewer LDL molecules on the other side coming into the bloodstream as there were on the inside, because they're now getting used preferentially by the liver. So essentially what the statin drugs do is they don't lower LDL by themselves. They just make your liver cells pick up more LDL so that your LDL is actually being used, and the liver cells are not using their own supplies. They're using the supply from the blood. Now, of course, on the other side of that, let's go back to our picture. If you have less LDL floating around in the blood, that means you're going to have less LDL penetrating into the cell wall, fewer LDL particles becoming oxidized, and if they're not becoming oxidized anymore, then the immune system or the infection-fighting cells are not going to get upset. They're not going to be pumping out all this chemical to make this whole thing so inflamed. And then ultimately, if we can reduce all the activity in here, and if this thing doesn't grow anymore, if there's no more danger signals because there's hardly any LDL around, then our goal here is that we hope that this shrinks a little bit. Now, just a warning, the question we always get in cardiac rehab is, can these shrink all the way back to normal? And I just want to, tell you frankly, we think, we know that they shrink a little bit, but they shrink very, very slowly. And to some extent, they can get smaller, but we probably wouldn't expect these to shrink right down to zero unless we did this for a very, very long time. So essentially, though, it actually doesn't matter in some ways, because as long as we stop the activity in here, if we stop the activity, again, by if you exercise lots, if you're lots of physical activity and a good diet, then we can ensure that the LDL you have in your blood, you're using it for good reason. It's not getting locked up in here. And then if it's not, this thing can shrink a bit. But even if it doesn't go away altogether, if it doesn't grow, if it's not growing really quickly, then essentially, what is thought that happens is I'm not drawing this very well, but a really thick skin will grow over top of this this blockage. And if this really thick skin grows over top, because it just basically has been stable and static for such a long time, that this will just kind of harden up, like any kind of cyst or anything in your body that just doesn't move. And if this skin gets really, really thick on the top, this little fibrous cap, then it won't break. It can't break. And really, this is where, for those of you that maybe have had a stents put in, we know that some people get stents put in, but maybe the doctor couldn't get at some of their blockages. There might still be blockages left in there, and there might be blockages that you can't see because they're too small at the time. We're really pretty certain that it's okay that you didn't get a stent on all of your blockages, as long as we take care of all of these things. If we take care of LDL, we take care of diet, we take care of your endothelial cells, that if we can just stop the activity inside those blockages, the vast majority of people don't even know they happen, know that they're there. So our goal in the short and long term is not necessarily to get rid of all those blockages. Frankly, we don't really think it's possible to do that. I know if you look on Google and you can see all these products that just clean out all your blood vessels, 35 years of blood vessel blood vessel inflammation just cleared up in 2 weeks. We really don't think that's possible. But in our view, the practical goal here is to stabilize those things. Obviously to shrink them, but to stabilize them so they don't grow. If they don't grow, it means they're not inflamed, and that means they won't break. We want them to harden up and then shrink slowly, but to stabilize them and keep the endothelial cells on either side of those, to keep those endothelial cells on either side of your blockages to be healthy, and on the other side so they don't expand, they don't grow. And that's our goal about how we try to, prevent heart attacks in using all of these things, statins, blood pressure drugs. And if they do rupture, we have antiplatelet family on board to try to reduce the reaction of platelets that might plug up the whole vessel.